Children, welcoming them into this world is the calling of the purest love. It's the beginning of all things, wonder, hope, a dream of endless possibilities. But when the time comes for us to embark in the journey of love and care, how do we know we are ready for it? It all begins with a little faith. Faith in the hands of those we trust. Faith in turning the impossible into a reality of hope, to support us and lend a helping hand, to guide us in making the right decisions, to tell us that this is the beginning. A beginning to a life full of happiness, to never let us feel alone, to give comfort through the hard times and during moments of joy. This is what we believe in. Here at Sunway Medical Center Velocity, we want you to know we're always there for you, at every step of the way, together. We believe every parent and child deserves a perfect start. We extend our care to those who need it the most, to those who need a second chance, to give a mother's love, to give a father's strength, to give hope to every child in need, to make their first day in life the best day for you. We want to be there when your little ones take their first steps into the world of the unknown. We want to be there to let them see what they can achieve. We want to be there at every step of the way, and that's a promise we will make till the very end. So we ask, will you welcome us to take this journey with you? To prepare you with the right conceiving planning, to help you with your pre- and postnatal care, to take care of the welfare of your child, to be a part of your new family. Sunway Medical Center Velocity, a reliable companion to you and your loved ones.
Hello and good afternoon, everyone. My name is Unku Hanim, and I'll be your host for today's SMCV's virtual antenatal health talk event. So I hope everyone is feeling great and doing good today, staying safe at home with your loved ones. So first of all, I would like to say thank you for joining this virtual event. And before we proceed with these virtual talks today, let me go through a bit of the agenda. Okay, first of all, we'll be sharing a bit of information of Sunway Medical Center Velocity. Then we will have our first speaker, Dr. Wong Yen Shi, our consultant obstetrician and gynaecologist, to share about pregnancy during the pandemic, the importance of vaccination. And then we will have our second speaker, Dr. Hasmawati Hassan, which is our consultant pediatrician and neonatologist, who will be sharing about care for a newborn during the pandemic. Okay, also there's two registration link as attached in the comment section in our Facebook comment section, yeah. So the first link is for those interested to register for our delivery packages. So not to worry, the registration and cancellation are free, and the first 10 registration will get our Fifi hamper. Okay, second link in the comment section is a registration for those interested to receive goodies, complimentary of motherhood.com. So you guys may fill your details in the provided link as attached in the comment section, yeah? Okay, so before we invite our first speaker, Dr. Wong Yen Shi, allow me to share a bit of information or introduction to Sunway Medical Center Velocity. Okay. So Sunway Medical Center Velocity is a new addition to Sunway Healthcare Group. We are a multi-tertiary hospital and located in a part of an integrated township, Sunway Velocity, which consists of retail, residences, college, and also mall. We are located in Cheras, Kuala Lumpur, and just 3.8 kilometers away to KL City Centre. So we have opened the hospital to public since 3rd September 2019. We have 240 hospital beds and over 45 specialist clinic. We have our own cath lab here, our own dialysis department. We also have our chemotherapy day ward. And we also have our endoscopy department as well as 6 operating theatres here. So as a multi-specialty hospital, we offered a variety of multidisciplinary services. And these are some of the facilities and services offered here. Okay, sharing a bit of photos of facilities offered in Sunway Medical Center Velocity. Next thing is our room rate starting from 90 ringgit and goes up to 1,280 ringgit for Premier Suite. Okay, we also have our own neonatal ICU here in Sunway Medical Center Velocity. Okay, last part, I'd like to share a bit of our delivery packages here. So we have promotion for our normal delivery package as well as cesarean delivery package. Both we offer 30% off on hospital charges. If you guys have any questions or interested to know further about our delivery package, you guys can fill in your details in the comment section and we'll be in touch with you. Okay. So before we invite our first speaker today, Dr. Wong Yen Shi, without further ado, let's invite our first speaker today, Dr. Wong Yen Shi, to speak about her topic today, which is pregnancy during the pandemic. Hi, Dr. Wong.
Hello, hi, good
Hi,
afternoon.
how are you?
I'm good, how are you?
I'm good too, Dr. Wong. Okay, Dr. Wong, without further ado, let's start our health talk today. Over to you, Dr. Wong.
Okay, thank you. First and foremost, I'm Dr. Wong Yen Shi. I'm your OB-GYN consultant here in Sunway Medical Center Velocity. So, firstly, we'd like to thank Motherhood and Hanim for arranging and organizing this antenatal talk on a Saturday afternoon and, of course, inviting me. So without further ado and not wasting any time, so we'll be talking about pregnancy during the pandemic. So I was asked and I was invited to talk about the importance of vaccination, and therefore that will be the concern and the topic for today. Okay, all right, so let's start. And okay, so pregnancy during pandemic, the importance of vaccination. So and hello to all mommies here that you joined here. Okay, hope you guys are doing well on Saturday afternoon. All right, so first and foremost, let's talk about a bit, before we go about vaccination, let's talk a bit about the COVID-19 infection. So I think as most of us will know, COVID-19 infection is actually a result of your severe acute respiratory syndrome coronavirus 2, which was detected in Wuhan, China in 2019, okay? So to you pregnant mothers out there, I would like to let you know, and if in case you don't, actually the chances of you getting a COVID-19 infection is not higher than the general population. So your risk is similar to the general population. But if you do get or you do contract COVID-19 infection during pregnancy, your risk of getting a severe form of disease is higher than the general population. This is because of the changes of your immune system, especially in your second and your third trimester. So what happens when you are in your pregnancy? Your body has to, there are some changes to your immune system so as that your body doesn't attack your own fetus. And you have to have some changes in your immune system to prepare your body for delivery. So with all these changes, your immune system sometimes is lower. So if you do get COVID-19 infection or any infection for that matter, you are more susceptible to get a more severe form of the disease. Okay, all right. Looking at the statistics, in Malaysia itself, since last year, March up to this year, June, we have actually more than 3,000 pregnant mothers who have been diagnosed with COVID-19 infection. Okay, and this is the statistics up to June. And I'm sure now being in August, the numbers are even higher if it's not 4,000. Okay, and the number of deaths, all right, from COVID-19 infection in pregnant mothers has been a total of 70 this year itself, from January to July 2021. So we did not have any deaths last year, but we had 70 pregnant mothers, okay, dying, succumbing to COVID-19 infection in just the first half of this year. Okay, so I'll just show you a graph here. Okay, so if you look at this graph, okay, it's in Malay, but this is actually given out by the DG. So we have a total of about 3,000, closing up to 3,400 pregnant mothers that were infected with COVID-19 in the past, since March 2020 to June 2021. And if you look at the figure here, there is actually a total of 70 deaths. So if you see the graph on your right-hand side, the number of pregnant mothers being infected with COVID-19 has been on the rise since the end of last year. And with that numbers, the death too has increased. We had an average of 2 deaths from pregnancy for secondary to COVID-19, about 2 deaths a month. And in June this year, there were a total of 17 deaths. There was a drastic increase. And we can say that majority of the time, or in fact most of the time, the deaths that are from COVID-19 in pregnancy, right, these mothers are either not vaccinated or only have taken 1 dose of the COVID-19 vaccine. And 47% of these deaths, right, the mother had a comorbid of some sort. Okay, so moving on. COVID-19 transmission can be contacted through direct contact. Direct contact would mean that you're coming into contact with a person who is infected with COVID-19. And indirect contact would mean that you come into contact with surface, objects, or hands which have been contaminated by an infected person. Okay. Vertical transmission would mean that the risk of transmission of the COVID-19 viruses from a mother to the unborn child through the placenta. So studies have shown that it is possible, but the risk is uncommon. So many a times, if a baby has actually obtained or got infected with COVID-19 viruses upon delivery, likelihood it is actually gotten it out upon delivery, coming into contact with staffs or mothers, all right, after that. But vertical transmission is still a possible risk. Okay, so symptoms of COVID-19 infection in pregnancy, it is pretty much similar to the general population, okay, all right. Majority of the pregnant mothers that has COVID-19 infection, majority are still remaining asymptomatic. So 2/3 of these mothers will actually be asymptomatic. And of those with symptoms, 40% will have cough, 40% will actually have fever, 20% will have difficulty breathing, okay? Myalgia means muscle ache, all right? 20% will have muscle ache, 14% will have lost sense of taste, and then 8% will have diarrhea. So pregnant mothers are less likely to have fever and muscle ache in comparison to their non-pregnant counterparts. Okay, so there are a lot of mothers out there who are still very anxious, very hesitant about taking the COVID-19 vaccine. But let's ask ourselves, so what are the risks of COVID-19 if in pregnancy? Okay, so if you do get COVID-19 in pregnancy, you are more at risk of, number one, premature delivery. Okay, your risk of premature delivery is 2 to 3 times higher, all right? Your increased risk of intrauterine death or stillbirth. What does that mean? So that means that suddenly the heartbeat can actually stop inside the uterus, all right, and resulting in death inside the uterus, okay? So that's one. Increased risk of cesarean section for reasons such as, number one, fetal distress, where the baby's heartbeat is not doing well, or if the mother requires ICU admission, ventilatory support. We may even have to do a cesarean section to bring a baby out in order to be able to ventilate or ventilate the mother better. So more likely to develop preeclampsia. Preeclampsia is actually high blood pressure in pregnancy. Mothers who develop COVID-19 in pregnancy are also at increased risk of developing blood clots in their organs, namely the legs as well as the lungs. Okay, increased risk of ICU admission for mother and newborn, and also babies are more likely to have lower birth weights. Okay, so this graph, this chart, what I want to actually want to emphasize on is the one on the right side. So when you are pregnant, you have immune changes, your immune system changes. There are also changes to your heart, your lungs, okay? You are more prone to, certain mothers are more prone to develop diabetes, hypertension, okay? And with all this into picture, and if you have other comorbids like lung disease, blood disease, and diabetes, hypertension, then you are more prone to the severe form of COVID-19 infection. Okay, so again, here you see if there is they can emphasize on the right side, babies are more likely to be small, they're at risk of blood clots, stillbirth, miscarriage, preterm, okay, ICU admission. Moving on, okay, so let's talk about the COVID vaccination that's available in Malaysia. All right, I think most of you are very familiar about the COVID vaccines that are available. We have the Pfizer, we have the AstraZeneca, we have the Sinovac, and I think the one that's going to come in or is not already in is the CanSino Bio, which is your one-dose vaccine. All right, so mRNA, the first, as we look at this chart, there are three types of vaccine: your mRNA, your viral vector, and your inactivated virus. So your mRNA is your Moderna and your Pfizer vaccine. So what does the mRNA vaccine does? What it does is actually it stimulates your body to produce proteins, which then stimulates your immune system to produce antibodies, okay, which is what your Pfizer does. All right, and which is what is commonly used among a lot of pregnant mothers right now. Okay, viral vector is your AstraZeneca. So they contain modified genetic materials, okay, from the viruses, and then it's safely delivered to your body and then produces the antibodies. And your Sinovac is another form, which is the inactivated virus, where the virus has been killed using high heat chemical or radiation, delivered into you, and then form the antibody. So actually all are safe in pregnancy, okay? Just to emphasize again, all are safe in pregnancy. So pre-pregnancy, so talking about vaccinations in the three groups, I'll divide them into pre-pregnancy, pregnancy, as well as post-pregnancy, okay? The pre-pregnancy group, so I get a lot of questions from mothers that can I get pregnant if I've not completed my COVID-19 vaccine, or should I complete my COVID-19 vaccine before I embark on a pregnancy? There are mothers who are keen on IVF or fertility treatment. Should I actually complete my COVID-19 vaccine before I embark on an IVF treatment? Or there are those who are not keen on pregnancy who says that, can I take any form of contraception when I am pregnant, when I'm taking my COVID-19 vaccine? So the answer to all is here. So for those of you who are keen to embark on a pregnancy, ideally we would actually advise you to complete both doses of COVID-19 vaccine before you get pregnant. That applies to for fertility treatment as well. So because most of your COVID vaccines are anything between 3 weeks to 3 weeks for your Pfizer and your Sinovac, and up to 12 weeks, 9 weeks to 12 weeks for AstraZeneca. So ideally, it would be best if you can complete both those vaccines before you actually embark on a pregnancy or fertility treatment. Okay, so and it is like, I want to emphasize that this COVID-19 vaccine actually does not affect your fertility or your sexual function. And if for those who are not trying to get pregnant, any form of contraceptions are safe when you're taking COVID-19 vaccine. So I do have a patient that day who came to me and said that, well, she didn't, what she did was she was taking her COVID vaccine between the first and second dose, and she was actually on contraceptive pills, and she decided to stop because she was worried of the risk of blood clots. So, well, if you would have spoken to me, or we would have told you that it is actually safe to go on. So contraception, it is very safe to continue contraception between your first and second dose of vaccine. So there's no need to stop your contraceptive pills or any forms of contraceptive in between. Okay, and after completion your second dose of the COVID vaccine, you can immediately try and get pregnant or go for your fertility treatment after that. There is no necessity to delay conception upon completion of your COVID-19 vaccine. That is another question that is commonly asked to us, is that, doctor, I have just finished my second dose of COVID vaccine. How long do I have to wait before I can try and get pregnant? Do I have to wait 2 months, 3 months? The answer is no, you can try immediately to try and get pregnant. Okay, so moving on to the pregnancy group. If you look at the data that was given earlier, in Malaysia, up to August this year, 50% of the pregnant mothers have actually completed the first dose of COVID vaccine, but only 20 to 30% has completed 2 doses of COVID vaccine. Well, that tells you that the hesitancy, the anxiety, the anxiousness of actually going ahead for COVID-19 vaccine among pregnant mothers is still very high. A lot of mothers are still very anxious, very hesitant, namely with reasons, especially number one, top on the list would be worried of the effects on the unborn fetus. Number two will be they have reasons such as I have other comorbids, I have asthma, I have diabetes, I am worried to go ahead with the COVID vaccine. Number three, I have allergic reactions, I am worried, I might not want to go ahead with the COVID vaccine. Number four, the common reasons that I see will be family, spouses, social media is telling me that it is not safe to go ahead with the COVID-19 vaccine in pregnancy. So do speak to your obstetrician, your doctors about getting the vaccine, okay? Again, I would like to say that it is safe to get your COVID-19 vaccine in pregnancy, and you're highly encouraged to, okay? All right, not everything that you read on social media or groups may actually be correct. Speak to your doctor, okay? So by taking COVID-19 vaccine in pregnancy, number one, you reduce severe diseases. That means let's get it right that even having completed 2 doses of COVID-19 vaccine, you may still get the COVID-19 infection. But if you reduce the chances of getting a severe disease, all right, you reduce your chances of admitting into the ICU. You reduce the chance of stillbirth and prematurity for the baby. Okay, because again, we spoken about it earlier that if you do get COVID-19 pregnancy, you are more at risk of getting premature delivery 2 to 3 times. Your baby, the risk of your baby passing away inside your tummy is higher. Okay, so that by taking the COVID-19 vaccine, you help reduce this risk. Okay, and for you mommies out there, by taking the COVID-19 vaccine, you potentially also reduce transmission to vulnerable household members in your family. Your elderly is in the family. You have other children at home. Children are currently not given the opportunity, or they are not we have not started vaccinating our children yet. So by you taking the COVID-19 vaccine, you help reduce transmitting the disease to this vulnerable group as well. Okay. So there are a lot of mommies who still ask me, so COVID-19 is safe between 14 to 33 weeks. So, okay, so there have been changes with our Malaysian guide since late June. They are now being offered after 12 weeks, and you can also continue it beyond 33 weeks. So last time we said up to 33 weeks. Why 33 weeks? It's also I get phone calls, my patients text me and say, doctor, I'm getting my first dose at 34 weeks. So should I take it? No, it's too late. You know, guide says 33 weeks. So I always tell them, go ahead and get it. You know, you got opportunity, please get it. So why did we put 33 weeks previously? So there are multiple reasons, because if you have gotten your first dose, for example, Pfizer, 33 weeks, okay, and your second dose will obviously be scheduled 3 weeks later, maybe at 36 or 37 weeks, you see. So number one, we are, you know, if you're at 36, 37 weeks, there are reasons, you know, reasons like you becoming suddenly in labor already, or you may develop fever, you know, making monitoring a baby a bit difficult if you're in labor. So for reasons like that, but it's actually safe to continue your vaccines beyond 33 weeks. So I have patients who come to me and say, I'm 35, 36 weeks, I am getting my first dose. Should I proceed? I say, go ahead and proceed. Okay, so most of my patients, I would say, have safely gotten their COVID-19 vaccine, and many, I would say many of them have developed and delivered, and they're all doing very, very well. Okay, so so now the Malaysian guide has actually said it's 12 weeks. So, but there are mothers who ask me, can I take my vaccine if I'm not 12 weeks yet? I say I will leave that decision up to you. So if you read the FDA and the CDC, they said that COVID-19 vaccine does not increase the risk of miscarriage. Okay, so and if a mother wants to proceed and take the COVID vaccine early on in the first trimester, as long as she understands that, please do go ahead. All right, okay. And lastly, just to emphasize, COVID-19 vaccines do not contain any ingredients known to be harmful to a mother or the growing baby. Okay, so this is just what our this is just a highlight, you know, it's come up by the JJKV. All right, pregnant mothers are in the high risk group, and you're encouraged to get your COVID-19 vaccine. Okay, pregnant, now they've changed it from 14 to 33 weeks to pregnant women are allowed to get vaccination at any gestation after weighing its benefit and risk. And all types of COVID-19 vaccines currently used in Malaysia are safe and effective. So if you're offered any three of the vaccines, you can go ahead. All right. So pregnant mothers, again, you're a high-risk group. All right. You're encouraged to register for your vaccine. Okay. So, so a lot of couples, my patients like to ask me, so doctor, out of the three, which is the best? Okay, so again, emphasize all three are safe in pregnancy. But of course, if you look at data, mRNA vaccine, which is your Pfizer and Moderna, have the most available safety data remains, okay? And in the United States, they have already vaccinated 130,000 pregnant mothers, okay, with Pfizer and Moderna, and there are no safety concerns noted. All right. So, okay, so I get these other common questions from mothers. It's like, okay, doctor, I took my first dose of Sinovac or AstraZeneca, and now I'm pregnant. Should I change my second dose vaccine to Pfizer? So the answer is no. For the pregnant group or not, mixing different types of COVID-19 vaccines currently is not a standard practice. Neither is giving a booster dose in pregnancy is not a standard practice across the world till date. Okay, so of course all this will need further data in future. The other thing will be tetanus vaccines, and I'm sure those who are followed in the clinical setting, you get your tetanus vaccine. Some mothers are also taking their influenza vaccines when they're pregnant. So expectant mothers are allowed to take influenza or tetanus vaccine concurrently with COVID-19 vaccines. You do not need to gap 2 to 3 weeks or like what you used to be taught. Now, at this moment point, we say that you can take both of the influenza, tetanus with your COVID-19 vaccines concurrently. So, is there any role of monitoring of antibodies in pregnancy for COVID-19 vaccine? The answer is no. Okay, for the pregnant or non-pregnant group, monitoring of antibodies currently is not recommended. Okay, and of course, yes, we say that pregnant mothers are a high-risk group, should be vaccinated, but for the partners and spouses, you are encouraged to be vaccinated as well. Okay, so for the postpartum, then moving on to the postpartum and breastfeeding mothers, okay? So all available vaccines are safe for breastfeeding mothers, okay? So studies have been shown that if you vaccinate breastfeeding mothers, if you take the breast milk and check, there will be some form of antibodies of sort, okay? For mothers who have just delivered, when is the best timing? Unfortunately, at this time, we cannot give you an answer of when is the best timing. There's no specific interval. So the advice would be you're encouraged to vaccinate once you have made an uneventful recovery from pregnancy. So there are some of my patients who had a vaginal delivery within a couple of weeks, they actually went for their vaccine. Caesar sometimes after maybe a couple of weeks to a month, so they actually went for their vaccine. So this will be really individualized, and we'll see the recovery phase of each mother. Okay, there were also questions commonly thrown at me is that, do I need to stop breastfeeding before I take my COVID-19 vaccine, or after my COVID-19 vaccine? Can I still give the milk to my baby for the next couple of days? The answer is yes. So you do not need to stop breastfeeding prior or after COVID-19 vaccination. Okay, all right. Okay, so this one is another common one that I've seen in the last couple of months. Would be it's doctor, so I've taken my first dose of vaccine, then suddenly I'm pregnant. Should I wait till 12 weeks to get my second vaccine, or should I go ahead? So there are three options of doing it, all right? Okay, the first one will be, of course, waiting for 12 weeks, waiting up to when your pregnancy is up to 12 weeks before you get your first dose, all right? So the second option is totally don't get your second dose, or third one, go ahead and get your second dose before 12 weeks. So what are the pros and cons of each? So I'll just let you know. So the first one, waiting after 12 weeks. So you can do that if you want. So let's say you got your first dose of Pfizer, and suddenly you find out that or your AstraZeneca, and suddenly you find out that you're pregnant. For AstraZeneca, many a times at one point it was given a 12 weeks appointment anyway, but now I think they have reduced it down to 9 weeks. So, but Pfizer is supposed to be 3 weeks. So, okay, so if you get your first dose and you found out you're pregnant, so should you omit your second dose, or wait or delay? So the choice is really up to you. If you can wait until 12 weeks and get the second dose, so the effect of the first dose will not wear out, don't worry. Although the manufacturer says that, like for example, Pfizer, Moderna, you should just take it within 6 to, no, you should not get more than 6 weeks, but there are more and more studies coming out saying that if you delay it, the actual antibodies are still coming out, so you can delay it up to 12 weeks, no problem, okay? Omit the second dose, highly not encouraged, okay? Even though taking the first dose do confer some kind of protection, but how much, how long, we are still very uncertain. So option 2 is actually not really encouraged to omit your second dose. The third option, continuing your second dose before your 12 weeks, like we mentioned earlier, can if you want, especially mothers who are at high risk, mothers who are frontliners, mothers with multiple comorbids, right? We still encourage them, as long as they understand, if you want to go ahead, the second dose before your 12 weeks, the decision is, I mean, it's going to be a shared decision with your doctor and yourself, okay? All right. Okay, so I think this one is just a summary of everything that I've said, okay? And it's easily available online and most of the, in your vaccine groups and, the JKAV Facebook site, so you can get it. Okay, so, okay, this one, vaccination after COVID-19 infection. So, doctor, I have gotten COVID-19 infection, so do I still need to vaccinate? So the answer is yes, all right. You should, if you have just recently recovered from a COVID-19 infection, it is highly likely that you will have some form of antibodies, and it's highly likely that you will not get another round of COVID-19 infection for at least the next 6 months or so. But how much of antibody is made and how long will it last? We don't know, okay? And more evidence all around the world has actually started to come up and says that the COVID-19 vaccine gives more protection and immunity than the COVID-19 infection as well. So that's why it is still encouraged that people who have actually recovered from a COVID-19 infection to still go ahead with a COVID-19 vaccination. Okay. Only those who are, once you're well, you can go ahead with the vaccine, but only those who have required antibody treatment upon an admission, on admission, right, would require a 90 days wait prior to getting vaccinated. But I think less likely this would apply to pregnant ladies. Okay, so coming to an end, side effects of vaccine. Common stuff, you can get a bit of a mild low-grade fever, tenderness, swelling, redness at the site of injection, headache, muscle ache, tiredness. Okay, so these are common side effects, all right, of the COVID-19 vaccine. So again, for mothers, pregnant mothers, Panadol, paracetamol is allowed in pregnancy for mothers experiencing fever. You don't have to routinely take Panadol just because you're feeling really unwell and tired and so forth. But yes, it can help with headaches and fever. Okay. Do not routinely go and take Panadols before the vaccine just to reduce the side effect. It doesn't work. Okay. And if your hand is a bit sore, painful, swollen, you can always apply a cold towel on it, all right, to reduce the discomfort and swelling. Moving and exercising after a COVID vaccine is fine, okay? So contact your doctor if you develop an allergic reaction after the shot, and if the redness, swelling is getting worse, and if you think that the side effects are actually worrying or is getting or worsening, do contact your doctor or obstetrician. Okay, I think that's the end of my slide. Yeah, okay.
Thank you, Dr. Wong. Okay, we have, okay, now let's do a short Q&A session. We'll try to answer the questions in the comment section as well as personal questions sent to us. So first, I think I'll show this from Nurul Najla. She is asking how if the PPV won't let us taking the vaccine due to not reach 12 weeks. Do we need to provide referral letter, if any?
Okay, I think, yeah, good question. And well, you can always, if they don't allow you, I wouldn't say a referral letter, but you can speak to your doctor and work a way around it. I think sometimes they, and if the doctor can give you a letter to bring to PPV, why not? But I guess that would depend on doctor to doctor. But for my patients, yes, if they don't get their vaccine, if the patients want to get the vaccine before 12 weeks and is not given because of whatever reasons, then yeah, my patients do come to me for a letter. Yes. But I guess that one you have to speak to your own doctor and see how to go about it. But if like Clinic Kesihatan also do provide vaccines, if I'm not mistaken, so the nurses there would know how to go. I guess that would depend on the SOP of your clinic and your doctors. But yes, for me, I will. All right.
Okay, thank you, Doctor. For those who's watching, you guys can still ask the question in the comment section. We'll try to answer when we have time, yeah? Okay, next question is from Miss Shanaya. She's currently 34 weeks. Can I take first dose, then second dose after delivery?
Okay, like we mentioned earlier, the reason would be, Shania, would be, why would you want to wait after delivery to obtain the second dose? Because, well, after your delivery, we don't know how the delivery is going to go. Is it going to be a vagina or is it going to be Caesar and a recovery period? And then after that, so there'll be quite a bit of a long gap, you know, before you actually obtain your second dose. So if you're currently at 34 weeks and you've taken your first dose, I think if you're not in labor by 37 weeks, do go ahead with your second dose, yeah, rather than waiting. Unless you're 34, you've taken your first dose, and at 37 you are in labor already, then yes, then unfortunately you would have to miss it and then delay it. But if you're not in labor by then, I don't see any reasons why you should not. And I would definitely encourage you to go ahead and get your second dose. Okay, yeah, definitely. All right. So okay, Ginger has a question here.
Okay, let us see question from Miss Ginger Lee. What if the pregnant lady have G6PD, can take the vaccine also?
Yes, definitely. I have G6PD patients pregnant who have completed their COVID vaccines. Yes. Yeah.
The answer is yes.
Mhm.
Okay, next question from Miss Rachel. Will baby have COVID antibody after I've completed the second dose?
I would say yes, I would say so. Yes. How much? Of course. How much? How protective it is? I think there are a lot of studies that needs to still come out, to give us more answers. But if you do read from some articles from the Australia and the UK, where they actually took some COVID antibody. If you look at my Facebook page, there's something I posted on today. They taken some COVID antibodies from newborn babies after mommy's deliveries. They actually found some antibodies in it. But how much does those antibodies actually protect the baby? I mean, that is false. I mean, that is still to be known lah.
Hmm. Okay. I see a few more questions here from Miss Dede Lim. As the Delta variant is highly dangerous, is it recommended to have a third dose of vaccine during pregnancy?
Okay, so at this moment, no. As we have mentioned earlier, mixing vaccine and as well as booster doses is not a trend or recommended at this moment point till more data are out. So, couple of things. Number one, if you have taken the vaccine, we don't do antibody testing because you see there's so many vaccines there. There are a couple of vaccines out there. Each of them has a different pathway of developing your antibodies. So, right, and so if you go and do antibody testing, it may or may not be detected. All right. So yes, we know that the Delta variant is more highly dangerous, but also some of these vaccines they have already come out data that there is some protection. But at this moment point, there is not recommended to have a third dose of vaccine during pregnancy as of yet. Not by the CRC, not by the FDA, not by the UK, not by us as well.
Okay, I think I'll ask two more questions that sent to us privately, Doctor. Okay, the second last question is: should pregnant mom do a body checkup before getting the vaccine?
Well, if you are pregnant, you will be seeing your doctor on a monthly basis in the first trimester, 2 weekly, and then weekly. So you're literally seeing a doctor throughout the entire period of time. So I don't see any necessity to go for additional body check because you're already seeing a doctor throughout the entire time. So if you have any problems, speak to your doctor then, or if you do have problems, I'm pretty sure your doctor would have detected it during your appointments one way or another, right? Even if now, if you have comorbids like diabetic hypertension, right, G6PD is not really comorbid, G6PD, right, we still advise you to go ahead with your COVID-19 vaccine. So we see elderlies with a whole string of comorbids as well as heart diseases and all that, they too go for their COVID-19 vaccine and they're still okay, all right? Yeah.
Okay, doctor, one more question. Is it true that COVID-19 more severe in pregnant women? And if it's true, yes, why?
Okay, so again, they have gone. We have mentioned earlier, your risk of getting COVID-19 infection is similar to the general population, but the chances of a pregnant mother falling more ill, getting into ICU, severe infection, of course, it's higher because of the changes of immune system in your body. So, and the vaccine helps reduce that, right? Okay. Yeah.
Okay.
And then one question, right, Michelle? Is it normal to have nose bleeding after vaccine? No, Michelle, no. It is not to say common, but pregnant mothers are more prone to have nosebleed and gum bleeding anyway because of your hormonal changes. All your vessels are swollen. That includes all your bodies, including your nose and your gums and all that. So pregnant mothers are more prone to gum bleeds and nosebleed anyway. So it will not be a thing. It will not be a part of your vaccine.
Okay, I think that's all the time that we have with Dr. Wong today. Thank you so much, Dr. Wong. Anyone, the viewers, if you still have questions for Dr. Wong, you guys may share the questions in the comment section, and we will ask Dr. Wong personally and reply to your queries. Thank you so much, Dr. Wong, for sharing the very
Okay,
informational talk today. Thank you. Let us welcome our second speaker for today, Dr. Hasmawati Hassan, who is our consultant pediatrician and neonatologist, to share about care for a newborn during the pandemic. Okay, let's welcome Dr. Hasmawati Hassan. Okay, Dr. Hasmawati Hassan. Hello.
Hello, hi.
How are you?
Oh, still okay, still alive.
Okay, Dr. Hasma, why don't we start a bit with a bit of introduction about yourself, and then we can proceed with the talk.
Okay, I'm Dr. Hasmawati, consultant pediatrician and neonatologist in in this hospital, medical center, Velocity. I've been here since last year. Really. I'm a pensioner from a government hospital, but being a pensioner not working is boring. So that's the reason why I'm now under contract with the SMCB.
Primary Medical Center University. Okay, Dr. Okay, I think without wasting time, let us start with your talk today.
Okay, what I'm going to do is actually giving a talk on care of newborn baby during this pandemic. Okay, the thing is that what is worrying when this pandemic occurs? For us doctors, neonatologists, we are always worried whether the newborn babies will be affected or not. And the other issue whether because all this related with this contact with mom, whether breastfeeding of babies affected. And for the small babies, the small baby less than 2.5 kilo, the program kangaroo mother care in this baby will it be reduced or not? So these are the thoughts occurring in most of the neonatologist group where it is worrying us. So but what we know is that we need to understand what is actually this COVID-19 infection is all about. The routes of transmission is now known only by respiratory droplets. That means usually it's in the postnatal period. Okay. So there's limited reports regarding transmission in utero, intrauterine, intrapartum, or peripartum transmission. And the vertical transmission is rare. It's not unclear. And even data regarding this delayed cock campaign, skin to skin, because I know for breastfeeding policy, the skin to skin is supposed to be done. All this does not prevent COVID-19 transmission to neonates. Okay. So with that, the standard ruling is still happening in whatever situation you are. The standard protocol in COVID-19 pandemic is that there should be social distancing. Okay. So when this is applied to baby and mom, definitely should be this physical distancing, but there should not be zero separation. You cannot separate mom and baby, even though mom is COVID-19. Okay, because baby needs the mom for the care of the baby. But whatever is the standard protocol of washing hands, wearing a mask, and mom is pregnant, get a vaccine. These are all important issues when it comes to get your baby to be safe. Okay, so for this is just a comment because for I'm seeing some babies coming to me in the clinic wearing a mask. Usually, babies and toddlers under 2 years age should not wear a mask, because they have a smaller airways and they tend and breathing through the mask is harder. They can actually suffocate with it. And if you have handmade mask, the kid can actually choke on the string. Okay? And the baby tend to try to remove the mask, touching the mask, their face a lot. And this can actually, the risk of catching and spreading the virus is there. So try to avoid wearing a mask in the small babies, but you can actually wear a face shield like the picture that I'm showing you now. Okay. Okay. I think Dr. Wong has already informed regarding this vaccine in a pregnant lady and breastfeeding mom. So as you know, this year alone, 70 death of mom who's pregnant, and we have the celebrity Sarah who's died because not vaccinated, and she delivered a premature baby. Okay, so these are things that can happen. Okay? Because when you are pregnant and you got COVID, you are already considered as high risk. You are pregnant, you are considered as high risk patient. And when you have COVID infection, it affect the baby. It affect the baby in the sense that you can have premature delivery, and the baby can also die stillbirth in utero. So please don't worry too much. Get a vaccine when you're pregnant to help you and also the baby. So when we talk about regarding how bad newborn babies are affected if mom is COVID positive, frankly speaking, right now the current evidence is that this COVID-19 is uncommon in babies born to mom who is COVID positive. Okay? And even if they are tested positive, we're not sure how they got the virus because there's no data regarding is it vertical transmission or what. And usually most of these baby, if they are positive, they have mild symptoms or no symptoms and recovered. Few reports of this severe COVID-19 illnesses in newborn baby. But now it's a bit, this is the data which is actually from last year, they're saying that. But now with this Delta COVID-19 variant, I'm hearing now there's some baby came out not good, requires machine for a ventilator. So right now the data is not yet out. We have not yet really got a concrete data for this year. Okay. But the thing that who will actually get severe illness are those newborn baby, we have some medical condition, or preterm baby. They have usually high risk of getting severe illnesses from COVID-19. Okay. So studies have showed that if the COVID pandemic, the direct effect to baby is not much. Okay, you have a stillbirth base, it's still 0.0 Newton death. Even they will actually have some fetal distress. So it's no symptoms or mild symptoms for these COVID-19 positive babies. Okay, so that's good. So there are few deaths even in USA or globally. So it's much lower in the older population. But even they died of, we are not sure what is it because of it. COVID itself or is it whatever is the rates of dying in a newborn baby because of COVID remain low. But the hospital protocols will try all out to make sure the baby is protected from the virus. Okay? So that's our job. In hospital, if your baby's newborn is born, we try to make sure the baby is not infected with this virus. Okay. In end of May this year, the Ministry of Health actually reported to us that about 82,341 cases are positive in infant children, and it's the less than 4 years, which is actually for neonates, so it's 19,851. But their symptoms they are actually category 1, 2, 3, and none in ICU. So that's a good thing when it comes to children and infant. So now if you have a COVID positive mom, what do you do with the baby? Okay. So when the baby comes out, even the baby is well or not well, we still do this swab from baby. Okay. Usually it's done at 24 hours of life. And if it's negative, we repeat another one at 48 hours of life. Okay. For those babies that is discharged early, one single test is done, and this is taken from the nasal swab. Okay, nasal swab and nasopharynx. These are the two, nasal swab and oropharynx area. Okay. So the process of this thing, if you are a mom, if you're COVID positive mom, when you are going to deliver, we have to do some protective measures. Okay? One of it, the nursing staff will actually wear all this PPE, gown, everything, and you yourself will wear a mask. So what happens when the baby comes out? The baby will actually be put somewhere a bit distant from you, about roughly 2 meters, and if resuscitation is needed, then we do it a bit far from you. This is to protect from the baby getting virus from you. Okay? So this is at birth. So subsequently, we will just see how it's done. Okay, so usually most baby postpartumly, if you are positive, okay, the risk of getting from you is low, provided you take few steps. Okay, you need to wear your mask. You need to wash your hands, okay, during the care of this baby. Okay, so that is what is suggested. Okay, we have a guideline in our Ministry of Health how to go handling it, but we need to discuss with you whether you would, because previously, if in a normal situation, you're allowed to room in with baby. Okay, you and baby stay together. So, but in COVID situation where you are positive, you need to take certain precaution. Okay, so the rooming in has its benefit because the bonding between you and baby is there. The breastfeeding will be more established, so it has benefit. But you need to take precaution. Okay, initial temporary separation after birth is sometimes done, but subsequently, if you agree with rooming, you must. These are the few things that you need to do. One, the baby is usually kept about 6 feet 2 meters from you, unless you're doing something breastfeeding or care of the baby. Okay? And usually, what we suggest is actually put the baby in an incubator with you inside that room. Okay? The baby will be in a closed incubator in a room with you. Okay? And then what is needed, you need to do strict hand washing, strict hand hygiene, and wear a mask. Okay? So before you touch a baby, wash your hand. After breastfeeding, you wash your hand, and when you change nappy, always wash your hand. Okay? And that room will need regular cleaning and disinfectant for the surface. So this is what we want you to do if you want to breastfeed your child. Okay, so it's good to room in, but the precaution is there. So there's no such thing as zero. They call it zero separation. No, we want you and the baby to be the baby with you, but there are precautions that need to be done. Okay, so when do we separate? So this is a brochure, a pamphlet from Kementerian Kesihatan, where what is need to be done if you are positive. Okay, you need to wear your mask, pakai pelitup muka, okay, mengamalkan kebersihan tangan, basuh, hand hygiene must be done before touching your baby, even during breastfeeding. Make sure if you want to sneeze or whatever, you have to close your nose, okay, and clean your area, surface area near in that room, okay, and try to avoid touching the baby unless you want to breastfeed your baby or care of the baby. Okay, so the distancing, the so-called distancing, actually put the baby in a closed incubator, even the baby is with you in the room. Okay? So with that, the only time where we actually advise separation is when you are not well. When you are not well, or the baby is not well, means the baby like preterm baby requires intubation, ventilation. This is time that maybe we need to separate the baby from you. Okay? So this guideline, which is very important for you to know about it. Okay? And in terms of hand hygiene, make sure you wash your hands with soap at least 20 seconds. If soap is not available, then you need this sanitizer, at least 60% of alcohol. Okay, so that's in terms of rooming in you and baby when you are COVID positive. Okay. Well, the other one is whether this breastfeeding of babies be affected or not. Okay. The standard guideline by our World Health Organization is still the same. Okay, even in COVID pandemic time, where when a baby comes out, it's encouraged to do early skin to skin, still there, and get the baby mother to be rooming in, so there should not be any separation from mom and baby, even if you are COVID positive. Okay, practice rooming in, because breastfeeding is good for the baby, and the antibiotic, if you have the vaccine already, the antibody actually goes to the baby. Okay, and the only thing, the precaution that mom needs to do is actually respiratory hygiene, hand hygiene, and also cleaning the surfaces. So the protocol is still the same: exclusive breastfeeding for 6 months, and if the baby is less than 2.5 kilo, beside breastfeeding, kangaroo mother care is allowed. Okay, and these babies is then subsequently follow up, and we need to check whether the baby is fine or not. Okay, so these are still the standard WHO guideline. There's no change in the guideline at all. Okay? So in terms of breast milk, people are worried. If you're COVID positive, can the breast milk spread the virus to the baby? No. current evidence suggests breast milk is not likely to spread the virus to the baby. Okay, so but you must decide whether you want to continue breastfeeding or not, because breast milk definitely provide protection against babies' illnesses. So and the best nutrition to these babies. Okay? So, but if you don't want to share, you're worried, you're afraid, okay, you do not want to share, you're afraid that you give the virus to the baby, then please express your milk, because we need your milk, okay, express your milk, pump, and we give to the nurse staff to give to the baby every 2 to 3 hours. Okay, it's very important to get you to produce milk and to prevent blocked milk breast engorgement. Okay, but if you are not able to do this thing, then I guess you have to temporarily stop your breastfeeding and subsequently get a lactation counselor to re-lactate again, so that in later on you will still give breast milk to your baby. Okay. Okay, the next issue is that this is rather controversial because everybody is worried how to go about it. Will kangaroo mother care be continued for babies less than 2.5 kilo? Okay, so kangaroo mother care is actually, if you look at the picture, is a skin-to-skin contact, which is not just at birth, but during when the baby is admitted in nursery. Okay? So usually the small babies, the premature baby or the low birth baby, I've been given this program, this kangaroo mother care, where the mom and baby stays together, skin to skin, for at least the minimum is 1 hour. If you can, if the baby is fine, everything. Sometimes the certain hospital where you will do it for 6 hours or 8 hours, and can be done for 24 hours if mom agrees. Okay, so this is good. Strategy to help the baby to grow and to survive. Okay, there was a discussion, it's an international discussion in India in April 2020, where it's regarding kangaroo mother care with COVID-19, because what is noted that when this pandemic rise, what happened is that the kangaroo mother care ward is closed. The nurses not encouraging mom to do kangaroo mother care for all these babies, and mom is hopeless, helpless, don't know what to do. Even the breastfeeding was affected. This KMC was affected, breastfeeding was affected. So WHO has, the World Organization has said that kangaroo mother care should still continue, because with this COVID-19, because it's only affect this pandemic, affect the quality of care to all these small babies, and the higher of death is higher, the risk of higher death is there because of not doing this quality service to the baby. This because so what happened now is that there was a study by this Nicole Minkas, where all these babies is born preterm and low birth weight baby, giving this kangaroo mother care can actually save 125,000 babies. Actually, just by doing kangaroo mother care in this COVID era. So with this research, by not doing kangaroo mother care can actually kill the baby. The quality of care in this in neonatal unit will be actually reduced. So now everybody is telling us, please do kangaroo mother care. Okay, that research was a very important research, because if mom is 100% transmission, all the moms 100% transmission, could result only with 1,950 neonatal death from COVID, but you can actually save 125,000 neonatal life just by doing this kangaroo mother care. So the benefit of kangaroo mother care is about 65 more higher than dying of COVID-19. Okay, so what happened now is that they estimated, because of not doing kangaroo mother care, 50% reduction in not doing kangaroo mother care can actually result in 12,570 deaths. And in total destruction, the death of all these small babies is higher. So that is worrying. So now, right now, with that conference, everybody is now telling people, please continue kangaroo mother care, because this will actually save the baby's life. Okay. So now, so for all these babies, if you are COVID positive, the newborn baby is now encouraged to do breastfeeding, and for the smaller baby, kangaroo mother care must be continued. So when do we discharge this baby? It will depend on the condition of the baby. If the baby is fine, we discharge early. That will be the doctor's priority when to discharge. And subsequently, what happened at home will depend on you yourself in terms of your endpoint of incubation. In terms of separating yourself from the timing. Okay, the baby is fine to go home. Okay, but if the baby is also COVID positive, then there's the isolation period must be also there. So the isolation period for you as a COVID positive mom will be your period ends after 10 days since symptoms first appeared and 24 hours of no fever, and your symptoms improve. Okay, but if you do not have any symptoms but you're COVID positive, then your isolation period is 10 days after the date of your positive COVID test. So you need to understand this. Okay, so even if the baby is, you are positive, the baby is positive, the concept is still the same. The baby doesn't have anything, there is a 10 days 10 days of isolation period. So, okay, so when this isolation period ended, you still need to wash your hands, okay? But you need to do not need the extra precaution like distancing from you and the baby, no, okay? So that's important. So most likely after this 10 days, you would not pass the virus to the newborn baby or any other close contact. Okay, so when you go home, the issue will be most of us, when a new baby goes home, they will try to introduce to the other members of the family. Okay, this is one area, please. The social distancing is still there. Okay? So the what we want you to do to make sure is that do not get COVID to your baby. Okay? So those people that do not live with you should not come and visit. No visiting until the COVID pandemic is over. So if you want to introduce your baby to anyone else, to your family, to your grandma, to your parents, it should be the style of the social media, Zoom in, Skype, FaceTime. All this should be done. Okay, I just had a parents 2 days ago who actually showed me the baby. I think the 1 year birthday with a zooming technique. Oh, that was good because all the family did not come, but they zoom with the baby's birthdays, cake, everything. So this is the technique that you have to use for social distance, so for social communication with the rest of the family. Okay, and when you are home, please wash your hand. Okay, wash your hand frequently before touching the baby. Wear your mask. All these are very important. Very important to make sure your baby is safe. Okay? And please never take your. Sorry, I have to tell this. Don't take out your baby out. Do not go to shopping area. Do not go to pasar malam with the baby. Please, you can go out, but not bring your baby along. Avoid taking these babies to all this congested place. Okay? And I think that's about all that I have to tell. These are all my references, and if there's any question, I'm willing to take any question, please. Thank you.
Okay, thank you so much, Dr. Hasma, for the very informative talk. Okay, now we are opening the session for Q&A session. Okay, we have one question from the viewer here. Let me pin the question from Miss Muslimah Anifa. She's breastfeeding mom. Can she take Panadol as a painkiller during the vaccination? And is it safe to her newborn?
Any medication take from mom, the percentage of going to the baby to the breast milk is 0.0 something. So don't worry, you can take anything. You can take the Panadol. Panadol is actually the safest drug to be used in a breastfeeding mom.
Okay. Any more viewers have questions? May drop your questions in the comment section. So we have some questions that's been sent to me. Dr. Hassan, sorry, the line was cut off just now. Okay. We have another question from Miss Rachel. Can father enter delivery room when wife delivering during this pandemic? What is
Okay.
your advice, doctor?
Okay, in most government hospital, they are restricting in terms of during this delivery process only the mom. Okay, only the mom. So even that COVID is tested on the mother to make sure the mother is negative. Okay, but if mother is positive because of the PEP thing, then it's for to protect the mom, for protect the baby and the staff. Even the father is not advised to go in. You can only the only thing that if you are insist on getting your husband to come in, then the husband needs to be tested. Okay, but I think right now in government hospital they are not allowing the husband to go in. In our private hospital, even we need to, if you really want to go in, then you need to be tested for COVID positive also. So those are the things that's been done. If a COVID positive mother is usually try to restrict a lot of people inside a room where the delivery is done. So the concept is that. So you insist and the father need to be tested for COVID also.
COVID-19, yes. All right. Okay, another more question from Miss Jasmine. She have a newborn aged 2 months. Will there be a high chance for baby exposed to COVID if the parents are positive? Yeah, I think this is...
The thing, the only way the baby can get infected with COVID is during the postnatal age. So if you are positive, you must take care in terms of all this social distance, the distancing, wearing a mask, get yourself hand hygiene, and the baby need to be put in a area. You cannot sleep the baby. It has to be 2 feet away on the baby. Okay? And whenever you touch the baby, you have to wear a mask, wash your hands, everything. So the risk is there. The risk is there when both parents are positive. The risk of getting your baby infected with COVID is there. So precautions are very necessary.
Yeah, taking extra precaution step.
Yes.
Dr. Hasma, a few more questions. Okay, for newborn infected with COVID-19, whether they have the same symptoms as adult?
The good thing regarding these babies is that most are usually asymptomatic. Even if that's the reason why God is kind in the sense that for newborn baby they are okay. Even if their symptoms will be mild distress, not much, they won't go into severe form. Severe form will be those babies that requires machine to help the baby to breathe. So most of these babies are well. Even they are positive, they are still okay, able to feed, not in distress. Even if they mild will be this mild distress, not requiring a lot of machine to use. So that's a good thing lah. I guess if mom is having vaccine will actually help the baby a lot. Okay, so the concept now all over the world, newborn baby are usually asymptomatic, means well, and if they have the symptoms only mild, not severe.
Oh, okay, but how dangerous is COVID-19 for a baby, doctor?
How dangerous it will be postnatal. If mom is pregnant mother positive, okay, the baby will come out okay. Now, if the mom is not cautious enough, it's only during the postnatal time. That means if you're not careful, you do not wear your mask, you do not wash your hands, everything, the baby can have it. So that's the time when the baby can have COVID positive, and that's the time, even if the baby is COVID positive during this time, usually the symptoms is not as bad as the adult.
Adults.
Yes, even during this time, I'm hearing that most of these baby actually have some fever. We have cases of that about 2-3 months age, only fever with diarrhea, but baby is well active. So the symptoms is not as severe. It will be just category 1 or 2, something like that. Okay, but never get 4 or 5. Category 4 or 5.
As we don't have any more questions in the comment section now, I'd like to get your tips or advice for mother, before we end this session, for mom who has COVID-19, what can they do if they are breastfeeding their baby? Some tips and
The concept is that please breastfeed your baby, but don't be afraid. All you need to do is this: wear your mask, okay? Wash your hand, breastfeed your baby, get the baby to sleep, and just put the baby in a place a bit further from you. You cannot put the baby at the back. Okay, so the concept is about 6 feet. Okay? So if you, let's say the baby is nappy, soil the nappy, so you can just wash your hand, take your baby and change the nappy and put that your baby a bit distant. Never sneeze to the baby. Okay, so in terms of caring, continue that, and at the same time, please sanitize your room. Okay, that is the virus. Okay, otherwise, this is what you do, because right now, giving breast milk is the most important. We have the from infection, so continue breastfeeding. Don't worry. As long as you do this concept, hand wash, wear your mask, just distance your baby yourself from the baby, then that's fine. Okay, but continue.
Okay.
6 months of breastfeeding is very important to the baby.
Yeah. Okay. Thank you so much, I think, Dr. Hasma. That's all the time that we have for today. Thank you so much for the very informational talk to our viewers today. Okay. So
Bye,
for
thank you.
everyone, okay, Dr. Hasma, I think we'll excuse here. All right.
Okay.
Thank you so much, Dr. Hasma.
Bye.
Thank you so much for everyone who's joining our live talk for today. So be sure to follow us on our Facebook and Instagram, as well as our website page, Sunway Medical Velocity, for more details and information on our future events, promotion, and etc. Also, a big thanks to our sponsor, Fifi, and also our partner, motherhood.com, for supporting the event for today. Thank you so much, everyone. I hope we see you guys again in future health talk. Thank you so much for your time.